This is a patient with post-trichomatous central corneal opacity. A combined surgery using anterior chamber maintainer would be now performed using the Blumenthal technique along with trabeculectomy. A conjunctival peritomy is performed along with dissection far posteriorly towards the fornix. Bedfield cauterization is then done. A frown-shaped incision 1.5 mm from the limbus is then created with an additional rectangular flap at the center. Sclerocorneal tunnel is dissected using a 2.8 mm crescent knife. Two side ports are created, one for performing capsulorhexis and the other for inserting the anterior chamber maintainer. The anterior chamber maintainer is inserted with a bevel up and then it is turned down. The anterior capsule is stained using trypan blue dye and it is washed. At this point of time, it is best to do the capsulorhexis under with a red glow, especially in patients with corneal opacity. A large capsulorhexis 6 mm or larger in size is created. A 3.2 mm keratome is used to enter the anterior chamber with the forward cutting movements. Hydrodissection is then performed. The nucleus is rotated in the back and then it is lifted into the anterior chamber. Viscoelastic is injected in the anterior chamber. An Aris repositor is placed behind the nucleus and a needle is used to aid the movement of nucleus out with the anterior chamber maintainer on. A bimanual technique of cortical aspiration is performed with the anterior chamber maintainer on. This is especially useful for aspirating the 12 o'clock cortex. Viscoelastic is injected and the bag is inflated. A PMMA lens is then inserted into the bag. The pupil is then constructed with pilocarpine. A 2 into 2 mm square shaped fistula is created using an MVR knife, which is later converted with a Vanna scissor. A peripheral iridectomy is performed. The vertices angle are then sutured using a 10-0 nylon suture. Two wing-shaped sutures are then placed after depositing the conjunctiva back using an 8-0 vicryl. Lap-forming sutures are then passed starting from the inner edge of the conjunctiva, going to the other side, taking a partial thickness bite from the corneal stroma and tying the suture